Hey guys, it's Dr. Collins, and I just wanted to take a minute and talk about Stephanie's case. Maybe some of you have seen that floating around on Facebook and YouTube. It was a case study on Stephanie and what was going on with her and how upper cervical care was able to help her get really more out of CrossFit and her yoga and a lot of the things she does to stay active. So I wanted to go into a little bit of the technical behind the scenes of what we did with her and how it was able to help. So because Stephanie is an athlete, she is a great example of how upper cervical care, releasing and properly aligning the atlas vertebra, can help dramatically transform the posture overall, because the head and neck and eyes and everything going on up here, it's so important for the body to keep the eyes level. Whenever you have an atlas misalignment and that's off a little bit, the body is going to adjust for that in real time by twisting underneath to establish a new horizontal gaze, is what it's called. So specifically, Stephanie was experiencing neck pain, decreased range of motion. She was having a hard time, and because she's an athlete, it was very obvious to her that her neck wasn't right. So why, right? Like, why is the atlas vertebra being displaced going to cause decreased range of motion and neck pain? So when that joint is off axis, and there can also be rotation that's in there as well, and as a part of that displacement, if you can imagine, the body knows that. The body knows that that joint is not right, and a lot of you can feel that in yourself. You know that it's tight back there, maybe kind of tender on one side more than the other, and you can just feel that that upper neck is off a little bit. The body will intelligently tighten up and guard you from going in certain directions if it's unstable. So something I'll hear frequently when people first come in before they get adjusted, and also when they go back out of alignment, is that they'll have decreased range of motion because your body will kind of lock up and prevent it. Because it doesn't want you to hurt your neck or have spasm. It will stop you from going, maybe you can go 60 degrees on one side and only 40 on the other. It doesn't want you to get that extra 20 because it could cause a bigger problem. So for athletes, for people who are active and trying to be able to have that active lifestyle and day-to-day, whenever that atlas is out, you may notice that maybe the lower neck is a little tight. Maybe the low back is pulling a little harder on one side. Sometimes people can even have that sciatic pain that will radiate out of the low back, or even radiating pain out of the lower neck. A lot of people can have that nerve root type pain. So how is adjusting the upper neck going to affect the low back and things like sciatica or radiating pain? Well, your head is like a bowling ball in terms of weight, right? You have a 10 to 12 pound bowling ball on top of the cervical vertebra. Whenever the atlas, which is shaped sort of like a cup that the skull will rest in, whenever that is slightly displaced under the skull, the body has to mitigate that displacement because it brings with it some head tilt. What it will do is primarily tighten up and pull on the muscles of one side of the low back, typically opposite of the head tilt. So in my case right now, it would be like my left side. The body will pull and draw over and create a new normal. Now this head and neck are still out of alignment, there's still compression going on up here, but the body has now achieved a new horizontal gaze to try to mitigate that. And it's for a lot of different reasons, like your inner ear, your balance systems, things like vertigo, migraines, TMJ problems. The body wants the head and eyes level. So restoring the atlas alignment is critical for anybody, but especially an athlete, if you're looking to do things like bilateral lifting, any type of running, things where the body needs to be symmetrical and capable to handle loads or duration of activity. That's what can feed a lot of chronic pain and feed a lot of injuries when a body that's out of alignment is trying to load or do a WOD where they go through a whole series of exercises for a certain period of time. You have basically a weaker, compromised frame that will be more likely to tear at weak points or have damage. So for CrossFitters, for people who are athletes trying to be active, the atlas being in proper alignment is critical. So for Stephanie, how did we get her fixed up? What were we doing with Stephanie? The adjustment is actually done. No popping or cracking on my part. Everything is engineering based and using digital x-rays and actually a sound wave to release the atlas back into its normal range of motion. So we brought Stephanie down onto her side and taking the information from the x-rays that have all been measured accurately, we know exactly how that joint is out of alignment, so we are able to influence it and then release it back into proper range of motion. So using the table, we influence all of that head and neck and joints and everything back to where they should be. And then the last step is releasing the atlas back to where it belongs to take pressure off that area and allow the posture to open up. And because there's no popping or cracking and everything is very refined and exact, it's a controlled release versus me trying to go in there and sort of rattle things around and move things around. We want to have a nice, accurate, controlled, balanced correction in that area because I want her to hold that alignment. I don't want her to have to be adjusted all the time. So I hope this helps you guys kind of understand a little bit of upper cervical care, and especially if you're an athlete, this video is for you. I'm doing this right now so that you can find out about what I'm doing, and I'd love to hear from you. I'd love to get a Facebook message or have you fill out the form on our website. Give me a call. I'd love to hear what's going on with you. If you're experiencing neck pain, decreased range of motion, if you have muscle pain, if the body feels asymmetric, if you have stuff that's radiating, your body's dysfunctional, and you need to get that cleaned up for injury prevention and so you can get more out of what you do. So I'd love to hear from you guys. Thank you. God bless.